Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is like Monday, because it's the day after Labor Day.
Right.
I worked Labor Day.
It really is a Monday, except for it's Tuesday.
Okay, stop stretching your hip flexors. Here's why. And we're going to do a test to decide if your hip flexors are tight or loose.
Right. It is very true. A lot of times people do have tight hip flexors, but it's a simple test to know for sure, because if you do not have them and you start stretching them, that could lead to other problems. So this is it.
And we'll get into that. By the way, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us. Once again, we are giving away something, Brad.
Ah, yes.
But we're actually giving it away on YouTube, too. So if you look for our video on the, it would be the TENS unit.
Right.
TENS unit giveaway. That's it.
Yeah.
TENS unit giveaway.
Yeah, it's like you're making this up off the top of your head. You know, it must be Monday. Anyways,
so 5 of them. But anyway, Facebook, Bob and Brad, if you go there, it's pinned to the top of the page. You can find it real quick.
So TENS unit is a great device for pain, particularly chronic pain, so you don't have to take those opioids and pain meds.
Yeah, we really like this one by iRelieve. We really are off on the tangent here now. So
yeah, hips we go. Let's talk hips.
Yeah, everybody's like talking like that hip flexor, you got to unhook those hip flexors, you know.
Right.
And many people you do, but if you have a loose joint, you don't want to be stretching it.
Right, yeah, if the muscle's already loosened, you just go to end range, what the therapists call that, and stretch a joint into end range over and over. That can cause joint problems.
Right, and for example, if you're one of those people that happens to be kind of loose all over,
right,
and I'm not talking about your sex life.
Bob is a family show.
Yeah, you go ahead and you can take your thumb, this is one test, and see how close you can get to your forearm. If you're one of those people that can put the thumb on the forearm, you might be one of those people that are loose all over, and you may not need to stretch your hip flexor.
Sure.
We'll show you a test.
Right. So are we going to go do the test,
Yeah,
Bob?
why don't we do the test,
People
Brad?
are waiting.
Okay, Brad.
They're always complaining about us not getting to the point.
All right.
All right. So this is a test that's been going on for many, many decades in the therapy world.
We learned it when I was a student.
Yeah,
that was
so you know it's old.
400 years ago.
Right. It's called the Thymus Test, and there's different ways to do it. But I like to do it with 2 people, because if you try it by yourself, particularly if you're not familiar with it, it can give you a false reading. So it's best to do it on a firm bed. A bed may not work. You need something firm.
Yeah, because if you get to the edge of the bed and it sinks down, you're not going to get a good reading.
Right. And you cannot do it on the floor. You have to do it, and you'll see why in a second. Bob, can you take this leg, pull it up? So we're going to flex this hip and hold it here, and that's going to lock the pelvis in, okay? Now we're going to take his other leg. We're going to let the knee bent. Now, my instructions are to Bob is just relax that leg, relax that side of your body, and then, now it's best to do this with a pair of shorts on or loose or stretchy pants.
Right.
If you have some tight jeans, it's not going to be accurate.
Also, you got to make sure, like, this buttock almost has to be off the edge here.
Right.
If I'm up here, it's going to stop here.
Right, it hangs up.
So it's got to get off the edge of the bed here.
Sure. It's a good point. Now, what we're looking for is we draw a line from the shoulder to the hip, and if it goes straight out, we're looking for the femur to drop below about 10 to 15 degrees. That's normal, okay? Now, there's a couple of muscles, the rectus femoris and the sartorius muscle. You don't need to know these, but as a therapist, we know that if this knee is bent, they're going to interfere with the iliopsoas muscle, which only crosses the hip joint, and we want to look at that too. So first we test it with the knee bent.
Which it might be up like this then.
Right. Now, can you relax, Bob? Now, some people may not know how to relax, but if they can relax and you see it drop down like this, you know, I know Bob right now, his rectus femoris is loose and his iliopsoas is both in a relaxed state.
Let's show what it looked like if it was tight.
Right.
So basically, he'd let go. I might be way up this far.
Right.
You know, and even when I go like this, when I rock it, it would come up like that.
Now,
and I've definitely seen that.
So at this point, you don't know which muscle group is tight, is responsible. Is it the deep ones in the hip, or is it the ones that are biarticulate across both? So what you'll do is straighten the knee out, and that eliminates that rectus femoris and the sartorius. Now, if you try this by yourself, Bob, can you hold your legs straight? A lot of people are going to tense up, and they're going to hold it like this, and you may not get an accurate reading. So a second person is nice to hold the leg here, and we're going to drop it down so they can keep muscles relaxed here and keep the thigh out of it, and then drop down. And again, now if you bend the knee and it's up like this, and you straighten the knee,
and it goes down,
drops way down, well, then you know it's not your deep hip flexors, it's the superficial rectus femoris, and then you're going to stretch those differently than the other group. But if it's both, this drops way down, this drops way down, there's no need to stretch your hip flexors. It may be actually damaging your hip joint because you're bouncing against the end of the range, depending on which stretch you do.
And conversely, if they're both tight, this is tight and this is tight,
right,
then you need to stretch both muscle groups.
Right, exactly.
So,
okay.
And you know, Brad and I were just talking before we filmed here. I get a pain once in a while in the front of my hip with running.
Sure.
And quite often it's just from a sleeping posture I do where I lay on my side. I'm gonna do it on this side, come over, Mike's here. And I bring the hip way too far over, and it's there all night long.
Sure.
It kind of pinches my, I think in the acetabulum there. And so all I do is put a pillow between my legs. But that's a good example. If you have a really loose joint, you're going to be more able to do such things like that, and it's going to give you more problems. So
right.
You don't want to stretch it.
Yep.
So,
should we show them the two basic stretches? Now, if you happen to be tight both ways with the knee bent and straight, you want to get the, let's grab that pillow. Let's show them. This is where you're going to kneel.
Oh, sure. Yep.
Now, if you're on carpet, you may not need to put a pillow down, but you're only doing this for comfort. And here we're going to keep the posture up straight and think about pushing the hip forward. Now this one, my knee is bent, and we may be getting a little bit of both, but the further you go forward, the more it gets that iliopsoas and less of the rectus femoris. And so we're gonna do this. You know, and Bob and I always kept good posture, you know, and I read an article and they talked about bending forward is still getting that deep muscle. I still think this is gonna be more aggressive on it, but I think, you know, for some reason, if you're unable to do this and you go forward, it's more comfortable, you're still going to be getting at that.
Yeah, and the other thing I throw in there too, Brett, is I turn the foot out a little bit.
Oh, yeah, that's a good point.
When I'm doing these, I bring the foot out this way a little bit more. It just it zeroes in on that muscle a little more. So
sure. Now, to zero in just on that rectus femoris, I think the prone position really does a nice job. You want to lay down, Bob? So on your stomach, and this, bringing up the knee like this.
And you could just go like this.
Yeah.
And stretch.
Right. It's a little awkward. It's not as nice as if you put a strap on, which I'll do that for you here now.
And it's got two loops here, so I can just go ahead and go like this.
Yeah.
And it's just a real easy stretch to apply.
Now, if this muscle's tight, you'll feel it before you even get to this point, because Bob's pretty much at a normal range. We know he's not tight, but if it's tight in this, you'll probably be about to hear, and you'll feel that all the way from the kneecap up to that ASIS, we called it, that pelvis bone, all the way along there versus a deep stretch is what you get on your knee. So
if you're fairly mobile, you can do it standing. I mean,
sure, right, like this.
Yep. I do. That's how I do it every morning.
Sure.
I stretch them both.
You bet.
Because mine do tend to get tight. I mean, they do tend to get tight on a lot of people because when you're sitting, the muscle shortens up.
And then the other question is that sometimes we forget to mention is frequency or how long to hold it. Now there's two different trains of thought that are most popular. One is to hold a stretch for 30 seconds, which for me, I'm not a patient person. I don't do it that long, although I think it's not a bad idea. I do the pressure on, pressure off, and I'll hold it for maybe up to 5 seconds, but I'll repeat it and try and be really relaxed and work on my breathing. Because if you breathe really relax and let everything relax, allow the muscle to stretch and don't force it, you'll have much better success. Bob, what say you?
Well, the other thing I'm going to say, Brad, is you can stretch yourself in a chair or a stool, but you need a chair without arms. And you can actually go like this off to the side, like this, and go like this. And stretch.
And it probably needs to be like a little taller.
Yeah, well, I do it in a regular chair, but it can't have arms.
Oh, sure.
I mean, it
right.
works
Yeah,
out
you got to
fine.
get the room.
So,
You know, there's so many ways to do these stretches, Bob. And once again, we're just here to show you some good options that we like. And I don't know what else to say, Bob.
let's just say thanks for watching, and please come back again.